Hey everybody, welcome to the Athletic Potential Podcast. This is episode 2. Today we are going to be discussing shoulder instability in a youth athlete. We're also going to talk over forearm training for baseball and softball players, long distance running, as well as when to go see someone in regards if you have an injury. So let's get right into it. A case I was treating yesterday, he's a 13-year-old right-hand pitcher who was having some shoulder pain, specifically when throwing at higher intensity, specifically like pitching or long throws from the outfield. The pain had not gone away for a few weeks, and so he then came and saw me. We did an evaluation. We found that he had a pretty irritable rotator cuff. Anytime we would try and use it, it seemed to really bother him. But he really tested negative for everything else. When we looked at his range of motion, he had excessive rotational range of motion on his throwing side compared to his non-throwing side. And then when we tested his strength, he demonstrates significant weakness when comparing side to side. Specifically, his right side was a lot weaker than his left. We initially started treatment working on the main concept of decreasing the irritability of the rotator cuff. This was done through activity avoidance, things that hurt. Basically, rule number 1 is what I tell my clients: hey, if it hurts, don't do it. And the more you can obey that rule, the faster this thing's going to start to feel better. We also used electrical stimulation to help decrease some of the pain, as well as had him only do, in baseball, we only had him field without throwing, but he was able to hit, so we allowed him to hit. We try to keep him away from activities that bothered his shoulder. In clinic, we then had him do a lot of rhythmic stabilizations, holding positions, isometrics, as long as they were pain-free, mainly just to try and get the rotator cuff to turn back on and do its job, but not in the presence of pain. We were able to do that fairly quickly within the first 2 visits, which was, I think it was 5 days since the time he started seeing me. Now, present day, I saw him yesterday for his 4th visit, I believe. He's 9 days out or 10 days out. His pain's completely gone in his shoulder now. He was able to hit over the weekend and actually didn't bother him, which was a great sign. And so yesterday's treatment was a lot of rhythmic stabilization, again, trying to get his rotator cuff to work in an unpredictable environment, to get it to fire at the right time to control his shoulder. The main thing I feel like he struggles with is he has a massive amount of range of motion, rotational range of motion, and he throws pretty hard for a 13-year-old. His main issue is he just can't control his shoulder. His rotator cuff isn't equipped, it's not strong enough, but it also doesn't fire at the right time, and it also really struggles to maintain the ball in the middle of the socket. And then that's why he started having pain in the rotator cuff, because it was getting overworked. So we used a lot of rhythmic stabilizations, holding the arm in a position and me trying to move him and him not moving it. And it's unpredictable, which really helps with the rotator cuff to fire. And the other thing that we had him start doing is for his home program, was some dynamics isometrics. So he's using a band. He'll hold his arm in a certain position, then walk away from where the band is attached, and then walk back and hold his arm in a bunch of different positions, mainly just to turn the muscles on and maintain those positions to work on endurance as well. Yesterday, since he was pain-free in all positions, we did test his strength again yesterday. He still showed a lot of weakness, not nearly what he needs to be and not nearly even close enough to the other side. So I felt like it was okay for him to start throwing lightly, no high-intensity throws. That's the only time he had pain, was in high-intensity throws. And so I felt like it was okay for him to start throwing lightly out to 90 to 120 feet, as long as he didn't have pain. But I also then put him on a more specific arm care protocol. In his case, I really liked the idea of not just doing bands. I liked the idea of doing multiple different types of exercises. In his case, we did the band routine, which is 4 exercises with bands. We did a free weight routine, which is using light dumbbells. In his case, it was 1 or 2 pounds, and doing 4 different exercises. And then I also had him do isometrics, holding end range positions that are pain-free for a certain amount of time with kind of a fun rep scheme. He would do 6 repetitions holding for 10 seconds, then rest 20 seconds, then do 4 for 10 seconds, rest 20 seconds, and then do 2 for 10 seconds. It's kind of a pyramid type of rep scheme, really helping to work on endurance. And I had him do that in 4 different positions, specifically the end ranges of external rotation and internal rotation. And this did not bother him, other than it just made him really tired. He had a hard time doing it, but he had no pain, which is a great sign. So I sent him home. I wanted to make sure that he could do that for the next week. So I'm not going to see him for a week. And the hope is when he comes back in next week, we'll retest his strength. Hopefully his strength numbers are getting a little bit closer to the same. If they are within the research normal, which I'm not really exactly sure what for his age range is, but if they're within the age range normal, then I will actually go ahead and start him on a little bit longer of a throwing program, meaning more than 150 feet, probably stay at around 150 feet and have him throw with higher intensity. I would do that and teach him how to do that here with me, using a couple different devices to kind of monitor intensity level. Some equipment that we have here that will allow us to do that, but I'll kind of calibrate him, so to speak, while he's here, then send him out and go on a throwing program for the next 3 to 5 days. If he comes back with that, with no pain, he's feeling pretty good, then we'll start a mound progression and get him starting throwing off the slope again. He is in the middle of games and in tournaments. He's anxious to get back, but good news, at his age, at 13, he can play other positions, specifically first base, and he can also DH, and he's a pretty good hitter, so he's still able to participate. And with his team, he just is unable to participate as a pitcher right now, but hopefully that'll change in the next few weeks. So that was the case for today. Shoulder instability in a youth player. The big key with him is when he came in, we looked at everything, and his pain was in the cuff and his rotator cuff, but that's because it was overworked and it was tired and become irritable. Kind of think like a tendonitis, but almost not even, it wasn't quite that extreme. But the main problem he has so much range of motion but no ability to control it that his rotator cuff just got overworked. And so we really have to train him to be able to hold the ball in the middle of the socket. And that was the main goal of treatment after getting his pain levels to go down. So that's our case for today. So as a brief review, every episode we're going to go over a case in the beginning, and then what we'll do is we'll move into a question and answer session from our listeners, and then we'll answer those questions, and at the end I'll give you a takeaway to go back and try and see if we can't help everybody improve their athletic ability. So let's jump right into the Q&A. So our first question today says, I have heard that training the forearm muscles in baseball is important to decrease chances of sustaining a Tommy John injury. What exercises would you recommend? I'm a high school pitcher, 17 years old. There's 2 things I want to cover on this. One, we do use this very specific protocol. I call it the elbow protocol. It's not that glamorous. It's basically 3 exercises that I like to have people do. And one of the things that I really like to do is the motion called ulnar deviation. And it's a motion that not a lot of people train, and it's actually really difficult to train because the way the arm and the wrist has to move, it requires maybe a little bit more specific equipment. We're lucky enough here at Athletic Potential, we have a device that we're working with that was designed by our building, or by our building owner, that's specifically designed to help target that specific motion and the muscles that are associated with it. A matter of fact, I think I got it right here. So let me show you this. This is something that we use. It's attached to a band, and I apologize if I can't get it on camera very well. But this is what we use for ulnar deviation. It's I think it's been super effective at helping our guys to really target. Sorry, I'm trying to get this thing off. To be able to really target the muscles that do ulnar deviation. Now, why that's important is because the muscle that lives right over the top of the UCL, the ligament that kind of keeps the elbow together when you're throwing, is a muscle called the flexor carpi ulnaris, and it does ulnar deviation. Ulnar deviation is this motion here. And so we use this guy. The band goes up and around, goes through the trough. You then take this and attach it to something over here, and then what you would do is then hold the band out this direction. Sorry guys, it's hard to see on this camera, but you can hold here, and then we pull into ulnar deviation this way. And it's a really effective tool. So that's one exercise that we use to help people get in regards to the forearm. I really like the idea of pronation, supination. Most everybody knows about that one. That's when you rotate back and forth like this, and you get that bat going side to side. We use bats, we use hammers, we use all sorts of stuff to work with that. I feel like it works best if it's more in a free weight environment, not a band attached to something. The other thing that I really like that I don't feel like a lot of people do is finger flexion. So not only are you training wrist flexion like this and wrist extension, which is good, but really what I really like is finger flexion. So if you're going to do an exercise, you'd start with your fingers almost straight, then pull here, and then finish with wrist flexion, and then let it come back out. The reason is because the muscle that does finger flexion is actually attached near that UCL again and overlays it just a little bit. And I feel like it's important maybe we get that. And I think that's a commonly missed muscle that really could help with protecting the inside of the elbow. Now, in regards to elbow exercises, I feel like that's the more specific protocol that we use. One of the more effective exercise group or type that we use to really help with grip and or trying to protect that UCL is carries. So we pick up kettlebells. I have guys pick up kettlebells and walk for a certain distance. So they're maintaining grip, varying weights, varying grips, different. It doesn't even have to be a kettlebell. It can be a farmer's carry bar. It could be, it could really be anything. It could be a dumbbell. But the idea is that we vary grip training and carries, and I feel like that's also a really effective way to train grip and those muscles that may help protect the UCL. So I think the key with the elbow training and for me is, one, guys are picking up heavy weights. That's grip training, that helps. And so I think lifting weights is nice, and that'll help. So think deadlifts and trap bar deadlifts, and even some row variations where you're having to grip and pull. Those things are good exercises do help with grip, but I think obviously we're doing them for other reasons as well. In regards to more specifics, I highly recommend carries. Carrying kettlebells, carrying farmer bars, carrying anything where you have to grip and sustain a grip over time. And then what we normally do is have everybody kind of finish off their routine for the day with that specific elbow protocol. I can tell you that over the fall when we had our pro guys in, every single pro guy that was around was doing those exercises specifically. And one, they weren't hard to do. They didn't take more than about 5 minutes, and all of them seemed to like it. And we didn't have any complaints with it. So we'll see how the season goes with all of those guys, but it's something that we really use with our pro guys this year. So that's forearm training. Now, what I will do is include underneath in the show notes here a link to that specific elbow protocol, some videos that's on YouTube. You can go check that out and start implementing those. I don't think there's any reason why you couldn't do that. So, all right, question number 2. I am a coach of a 13U softball team. I've been having them run for 10 minutes to improve their endurance, but I heard that this may not be the best thing for them. What are your running recommendations for softball athletes? Well, let's just lump in baseball as well, because obviously very similar sports, and I think you could probably answer this question for baseball players very similarly. My favorite way to condition for baseball players and or softball players is interval training or short bursts, where they run a certain distance, have a short time period or a very designed time period of rest, and then they repeat again and then at higher intensities and run. We don't typically do a lot of long duration, steady state type endurance running, those type of things, only because I just don't feel like it fits the sport. It doesn't fit the muscle contraction types that the sport uses. So I feel like the best thing we can do, and I know this is a highly debated topic, tradition and old protocols really indicate, hey, maybe we should just do run pulls, or you need to go run to 20 minutes to flush the body, which I don't disagree with, but I think we could do better than just having guys run a long distance. So I think the thing that I would have everybody, what most people do here when we are training, we'll go back to the pro guys, is we actually ran intervals. So they would basically run a certain distance. In our case, I think it was 100 feet. I don't know why I chose 100. I think it was convenient. We had something that was already set up. So we ran 100 feet. They would run past the end of where they were supposed to, 100 feet, slow down, just cool off, stop, and then turn around. But when they walked back to where they had finished at 100 feet, that was the start of the next run. So then they would run from there back to where they started. And then they would turn around, and then they'd go back. And as soon as they got back to the line, then they would go again. And we do anywhere in the rep scheme from 8 to about 16. I didn't feel like we needed to do more than that. We had, that's not true, we had one guy go 20, but I had him run at a lower intensity because he was getting some quad stuff that just didn't seem to work really well at higher intensity runnings, but I still wanted him to do some interval training and try to get his quad to do its job and to feel a little bit better. So we had him run a little bit more, but less intense. But anywhere from the 8 to 10 to 12 range will probably work for your softball athletes specifically. I would take the distance that they are going to be running on the field from base to base. I would add maybe 10 feet to that, run that distance, have them slow it down, turn around, come back to where they had finished the run at full intensity, run back to the starting line, slow down, turn around, and come back, and just do however many reps you feel like they need. It doesn't need to be a lot. I've never trained with higher repetitions on those. I just haven't seen the benefit of that yet for at least baseball and softball athletes. So I hope that answers your question. If you do have, if it doesn't answer your question, shoot me an email, mike@athletic-potential.com. I'll make sure I give you more specifics. Happy to do that. All right, question number 3. Let's see. My son injured his ankle while playing in a lacrosse game. As a physical therapist, when would you want to see someone after an injury? In the past, I typically wait a few days, and then if the pain is still present, then I'll take them in. Is this the correct approach? This is a pretty loaded question. And I think if you asked 5 different physical therapists, you may get 5 different answers. And so what I would suggest and what I would prefer was I see that athlete almost immediately. And the reason is because I feel like we can negate a lot of loss, a lot of problems that come from waiting for something to get better. So we don't lose range of motion, we don't lose strength, we don't see excessive swelling. I think we can take care of a lot of those problems if we can see them fairly quickly. We can get them doing the right things that will optimize their road to recovery, and then we don't have to fix as many things later. The other thing is if your athlete, your son, so if your son injured his ankle in a way that we felt like it needed further attention, more than what a physical therapist could provide, then we could quickly refer you and get you in somewhere that will get him on the road to recover a little bit faster. So if you needed imaging, we could send you to a doctor, and the doctor could order that, or depending on the state you're in, some of the physical therapists can order imaging. But the idea is the sooner you get into the therapist, the better decisions are going to be made to get your athlete back onto the field. And so in my opinion, I really like to see athletes almost immediately, day of or the day after is my preferred. Now, obviously I'll take them whenever I can get them. Weeks later, that's fine, but the key here is that they get in sooner than later because we can negate certain problems. We're talking about ankles. We could talk for a long time about ankle sprains and the problems, long-term problems with ankle sprains. But I can tell you, in regards to ankle sprains, I really like to see those patients or those clients the same day, if not the next day at the latest, because we can put really good protocols in place, specifically, getting the swelling out of there, keeping mobility, maintaining good proprioception, or negating the loss of balance, so to speak, and really getting them back onto the field to play faster. So, I think that's probably my best recommendation there is get them in fast. Find someone who can get them in that day or the day after. It can be a doctor too if you really want to do it that way, but you ask specifically as a physical therapist. As a physical therapist, same day or the next day, that's my recommendation. We can definitely do a lot of good if we are able to see those clients quickly. So good question. All right, that was our last question for today. So 3 questions for today. Like I said, we'll answer as many as we can. So if we get a lot of questions, we'll answer them all in this podcast episode. So today, the key takeaway here, looking over a subset of our questions and some of the things we've already talked about, I think the key takeaway here is a concept. And what I want to kind of everybody to walk away from this is, if you are trying to achieve an athletic goal, most likely you'll be able to find a program that's out there that will help you. But notice how each one of the questions and the case that we talked about has an individualized approach, has an individualized kind of twist on it. And I think that's really where people excel, is when they have not only a program, but they have a program that's specifically designed for their needs. And it's something that I see, like I said, I see a lot of baseball players, a lot of softball players, and what I found is I can't give the same programs out to the same guys and the same girls. It works, but then it doesn't work. What we have found in the past is an individualized program far outdoes any other program that can be just handed or bought off the internet and you just go do it. I just don't think those things work as well as they possibly could. They may work in certain types of sports or certain types of activities. I know running is one that it seems like a little more general programs seem to work, but even then, if you had a more tailored approach just based on your body type, your current mileage ability, your age, your running history, those things, you could shave off a lot of time, a lot of pounding, so to speak, on the body if we could customize those approaches. And so I highly encourage anyone out there that is looking to achieve athletic goals, if you don't have a coach, it's probably worth your time, your money, your energy to get a coach. I know we do a lot of coaching here at Athletic Potential for different types of athletes. Sometimes that's a once a week thing over the internet, and that will get people where they need to go. And sometimes it's full time. You know, we had our professional baseball players in, and those guys were 5 days to 6 days a week. And every program was handpicked, individualized for those guys who were working with us. And we know that we definitely saw the better results for those, for our clients that had those approaches. And so takeaway here is, if you have a program and are working through a program, consider reaching out to someone who is in your area or even online that you'd consider to be an expert or knows really what they're talking about, and asking them, at least having a conversation via email or calling them and getting their opinion of what it is that you feel or that they feel would be the best for you. You may even sign up for their programs, or maybe you just try and talk to somebody and get some good advice. But I highly suggest everybody reach out to a coach and try to really individualize your programs. I think you're going to see a lot more results in regards to getting back to what you want to do, getting back, if you're injured, getting back to what you want to do, but also being able to perform and getting to those athletic goals that you have. So, all right, that's it for episode 2 of the Athletic Potential Podcast. Please subscribe, rate, and review. That'll help us a lot. We appreciate your time, and we'll see you next time. Thanks.